Thank you, Stacia. Well, good evening to you, Dr. Marryshow. Let's have a look at let's have this conversation. Now, in the U.S., health officials have painted a grim picture. We must say, they're anticipating that infection rate could increase by some 100 million. Here at home, we've had the removal of restrictions and everything is not just here, but across the world. Dr. Marryshow, is this what was expected in year number 3 of this pandemic?
I suppose it was not expected, but given the nature of viruses, which have this tendency to mutate, then that should not have been like a big surprise to scientists or a big surprise to anyone in the medical community. This one is a different virus altogether. It's new, there's so much we don't know about it, and it has this tremendous ability to mutate, and this is what viruses do. And at this point in time, when many people thought that we would have been over it, we are still in the midst of a pandemic that is raging and continues to rage in the United States and right here in Grenada. But it rages because we have relaxed our precautions far too much at this point in time, when we simply do not know what the consequences are going to be and whether this virus, which continues to mutate, is having variants. And the latest one, which is the Omicron variant, the BA2, it is highly transmissible. And that is the cause for the real concern that is taking place in the United States. And the surge that we are seeing right here in Grenada at this point in time has a lot to do with that.
But Doc, let me ask you, the conversation has always been and would remain that we have to live with the virus. We see now that there's a lot of, the political climate is ripening, and there's a lot of events that's taken place. What's the advice?
I would say that we still have to take those measures that try to mitigate the virus. In other words, we have let down our guard too quickly, and right now we're facing the consequences of that. We have over 800 hospitalized, 800 active cases. We have at least 8 people who are hospitalized, some are serious, and we are just taking it up, I think, too lightly at this point in time, because this thing is real. This thing is not going away anytime soon from what we are seeing. And because it has this tremendous ability to mutate, we are having what we call the stealth virus, which is a variant of the Omicron virus, which is what is affecting us right now. And if we continue to just take things for granted, I fear that the worst is yet to come, because if the United States is predicting over 1 million cases in the fall, we must also be concerned down here because of the closeness that we have with that country. And then right now, we have to lift
the restrictions. It was premature.
People are not paying heed to the restrictions, the social distancing, the mask wearing, the washing of the hands, the hygiene that we're supposed to be paying attention to. People are just treating it as if it has gone away, and that is simply not the case.
So the whole conversation about possibly returning the wearing of masks, is that something that should be a conversation?
Yes, it should be, because look at the situation. We have 800 or more active cases in the country right now. And that can multiply exponentially in a very, very short space of time. That is how that virus operates. So it is rather foolhardy, as far as I'm concerned, to drop our guard at this time and believe that everything is back to normal, because it is simply not back to normal. We still have to continue to use the measures, the preventative measures that we have been using over the last year or so that we won't have this exponential rise in cases that we are seeing right now at this point in time.
Oh, Doc, we certainly will continue to heed the advice from members of the medical community as yourself and others, and we continue to play our part here. Thank you. That's the word there from Dr. Terrence Marryshow. Stacia, back to you.